5 words I never thought I would say. I'm an active 60-year-old woman with a loving husband, 3 beautiful children, and a grandchild on the way. After a recent checkup, my doctors determined that my cancer had come back and spread, or metastasized. I've done so much research, looking for support groups and resources to help those diagnosed with advanced breast cancer, but still have so many unanswered questions, and I found that other people are wondering the same. There isn't enough information available for those diagnosed, and it's time to go directly to the experts and uncover some answers. What are the differences between my initial cancer and my new diagnosis of advanced breast cancer?
When we talk about early stage breast cancer, we talk about a breast cancer that it's limited to, small lump in the breast with maybe just, like lymph node involvement.
With the early breast cancer, most women are cured of early breast cancer because they have only microscopic cells in their body, or in some cases, no metastatic disease in their body at the time of presentation.
Contrary to that, metastatic or advanced breast cancer, it's when the same breast cancer has left that area and has found a new place to grow outside of the breast and lymphatics.
Okay, I now wonder how my experience with advanced breast cancer will differ from my experience with the early stage of the disease. Outside of treatments, what do you find other people living with the disease are worrying about?
So certainly some of the biggest issues that a patient with metastatic breast cancer will discuss with me and that we'll try to work through together. First of all is that they want to prolong their life and have, just as important, a good quality of life.
Their obligations to their family, their jobs, their communities, they don't want a lot of side effects, if at all possible, and they want to be highly functional and have a great quality of life.
What will help us, me, feel better emotionally?
I think some of the advice that we should give all the patients with advanced breast cancer is to take their time to be ready to hear the information. Everybody gets there at different time.
Participating in different support groups, especially depending on the type of cancer that they have, may be helpful for some people.
We think that communication within the family is very important, so they can also know what to expect and how to help their loved one.
We, their caregivers, we become their family too. Their physicians, nurse practitioners, nurses, the receptionists, everyone in the cancer centers are big supports because we're all really, really there for them.
I know you can't predict the future, but do you have any idea what the future has in store for us?
Treating patients with advanced breast cancer, it's associated with great challenges and great satisfactions. Of course, it's a continuous challenge, try to improve our therapies, and it's really hard when our therapies fail to tell this openly to a patient. It's really difficult as a doctor just dealing sometimes with these discussions when medicine cannot do more.
But for the most part, over the next 10 to 15 years, the goal is to expand the number of patients who get these marvelous long remissions with excellent quality of life.
The satisfaction that we get when we treat patients successfully, it's enormous. And also there's a lot of satisfactions at a personal level when you walk this long pathway to a patient.
Every woman who does well from breast cancer today is standing on the shoulders of her sisters who came before her.
I encourage those with additional questions to talk to their doctors and ask them their own. But for now, I'm going to continue to search for and share information, educate those that don't know about advanced breast cancer, and keep on living life to the fullest.